Welcome to St. Elizabeth Healthcare, and thank you for choosing our team for your orthopedic surgery. Total joint replacement is considered an elective surgery, and therefore we have the luxury of being able to help you plan beforehand and provide you with all the information you need to have a successful surgical outcome. The goal of this education is to teach you how to properly prepare yourself, your home, and partners in your care for surgery. We want to ensure that you fully understand what to expect through all phases of a total shoulder replacement.
To ensure your safety, you will be required to complete the pre-admission testing process no later than 7 to 10 days prior to surgery. As a part of this process, a complete health history will be obtained, as well as the completion of testing ordered by your surgeon. This appointment may be completed remotely via telephone or in person, based on your current health status and physician preference. At this appointment, you should be prepared to provide a listing of any medication you are taking. This includes any prescriptions, over-the-counter medications, vitamins, and supplements. If easier, for in-person appointments, you can bring your medications with you in a Ziploc bag for review. The nurse will advise you regarding the medications you should continue taking, what medications to stop, and when to stop those medications. It is very important that you follow these instructions. Medications not appropriately discontinued have the potential to cause your surgery to be canceled or delayed. The pre-admission process typically takes about 1 hour to complete. If you see a specialist for other conditions, for example, a cardiologist, your surgeon may ask you to visit that provider as well to obtain their clearance for surgery. It is important to know that if you have had any recent dental infections, you should notify your surgeon for direction. It is also advised that you provide a listing of anything that you are allergic to, whether food or medication, during the pre-admission testing discussion. About shoulder replacement surgery. Your shoulder joint is made up of 2 key parts: the round head of your upper arm bone, called the humerus, and the shallow socket of your shoulder blade, called the glenoid. These 2 components work together to allow smooth, pain-free movement until something disrupts that balance. Shoulder replacement surgery may be recommended when the rotator cuff is severely torn and cannot be repaired, or when the shoulder joint becomes stiff, painful, or damaged due to conditions such as osteoarthritis, rheumatoid arthritis, fractures, or osteonecrosis. These conditions wear down the cartilage that cushions your joint, leading to pain, inflammation, and limited range of motion. There are several types of shoulder replacement procedures. Your surgeon will choose the one that best fits your condition. Partial shoulder replacement, hemiarthroplasty. Only the head of the humerus is replaced. Total shoulder replacement, anatomic arthroplasty. Both the humerus and socket are replaced with components that match your original anatomy. Reverse total shoulder replacement. The ball and socket positions are reversed, placing the round portion on the socket side. This option is often used when the rotator cuff has an irreparable rotator cuff tear. Rotator cuff sparing approach. This technique accesses the joint from the back of the shoulder, avoiding cuts to the rotator cuff muscles or tendons. It can reduce pain and shorten recovery time. The type of shoulder replacement you receive will determine your specific recovery plan and physical therapy routine. Your care team will guide you every step of the way to ensure a safe and successful outcome.
Diet. Proper nutrition is key to healing after surgery. Let's go over the foods that will help with your recovery.
Maintaining a healthy diet is important for your body prior to surgery and for your recovery from surgery. Your body's muscles and bones require good nutrition to heal. The following nutritional tips are recommended. High-protein consumption is vital to rebuilding muscle after surgery. High-protein foods, such as meat, fish, and dairy consumed in the weeks prior to surgery, can provide essential fuel to the body to support the healing process and prevent infections. Vitamin C can help with inflammation as well as with the absorption of iron, which also promotes wound healing. Foods high in vitamin C include broccoli, tomatoes, citrus fruits, and kiwi, amongst others. Increased fiber intake is important to combat constipation, which is a known side effect of pain medication. Stay hydrated. Patients who are well hydrated, excluding in the 2 hours immediately preceding surgery, can have less pain and have been known to do better after surgery. Patients who are dehydrated may experience post-operative complications. Finally, have a plan for your meals after surgery. Perhaps have nutrition shakes on hand or prepare some meals ahead of time and have them ready to go in the refrigerator or freezer. Your body will need good nutrition to promote healing.
Get your home ready. Setting up your home ahead of time can make recovery safer and more comfortable. Here's what to do before surgery.
Clean and organize your home. A tidy space reduces stress and lowers the risk of infection. You won't want to worry about cleaning during your recovery, so take care of it ahead of time. If you have pets at home, it's important to plan ahead. When you first arrive home, make sure your pets are in another room until you are safely inside and seated. After surgery, your balance may be affected, and sudden movements like a pet jumping on you or running underfoot can increase your risk of falling. Also, minimize contact with pets around your incision site to reduce the risk of infection. Avoid bending or twisting to pick up pets, and do not allow them to climb into your lap or onto furniture with you. Keep your incision covered and minimize contact with pet fur or saliva to reduce the risk of infection. With a little precaution, your pets can still be a source of comfort. Just be sure to prioritize safety during your recovery. Choose the right chair. You will want to use a sturdy chair with 2 arms to help you stand up safely. Rocking chairs, low or overstuffed chairs, and sofas should be avoided. It is best to have a plan and have your space set up prior to your surgery with frequently used items where they can be easily reached. Be sure to follow your surgeon's instructions. Pay close attention to any weight-bearing restrictions for your arm. These guidelines are in place to protect your shoulder and support proper healing. Make sure your home is well lit, especially at night. Consider placing nightlights in hallways or keeping a flashlight nearby for nighttime trips to the bathroom. Rearrange your kitchen. Move commonly used items to a location where you can reach them without stretching or lifting. Consider using disposable plates, cups, and utensils to avoid washing dishes during your recovery. Remove all throw rugs and items from the room that present a potential fall hazard. Things like coffee tables, plants, baskets, pet toys, etc. Install a handrail anywhere you have 3 or more steps. Install a safety bar anywhere in your home where it might be awkward to maneuver. These are not just for the bathroom. It is advised that patients stay away from those which adhere via suction cups, as they will not hold your weight and are generally unreliable.
Establish a partner in care. Having support after surgery is essential. Let's talk about why a partner in care is so important and what their role will be.
It is important that you have a designated partner in care who is an adult 18 years or older. This individual should accompany you on the day of surgery and remain on-site and available for contact throughout your surgery. It is recommended that they bring their cell phone so we can contact them throughout the surgery experience. He or she is encouraged to be present when the RN reviews your discharge instructions in order to assist with any questions you may have later. They should stay with you the first 24 hours after surgery and assist in the coming days. It is recommended that you have assistance for 5 to 7 days after your surgery. If you don't have close family or friends in the area, at least have a neighbor check on you a couple times a day. The longer you can get assistance with things like dishes, laundry, garbage, and pets, the better it will be for you so you can focus on your recovery and getting your strength back.
The day before surgery. The day before surgery is an important time to prepare, both physically and mentally. Next, we'll go through what you need to do to ensure you're ready for a smooth procedure and recovery.
Notify your surgeon's office if you have any symptoms of an infection. This includes respiratory issues like coughing or a stuffy nose, urinary symptoms, fever, vomiting, diarrhea, rash on surgical arm, or any lingering signs of illness. Even mild symptoms can increase your risk of complications, so it's important to speak up. Take a full bath or shower and wash with Hibiclens as instructed. Bathing helps reduce the amount of bacteria on your skin, which lowers your risk of infection. Be sure to include washing your hair as part of this process. Important: do not shave your operative underarm for at least 3 days prior to surgery. Shaving too close to surgery can increase the risk of surgical site infections. We recommend drinking 1 bottle of Ensure nutrition drink, Glucerna for diabetics, before going to bed the night before surgery. This can help you feel less hungry in the time frame when you're not able to eat prior to surgery. It has also been shown to help with recovery after surgery. Do not eat anything after midnight. Do not smoke or chew tobacco or use recreational drugs. Smoking increases the risk of complication and can hinder a patient's recovery. It is recommended that you stop smoking 4 to 6 weeks prior to your surgery. Avoid all alcoholic beverages for 24 hours prior to surgery. Follow medication instructions as directed by pre-admission testing. Try to get a good night's sleep and be well rested for your surgery. Sleep in clean pajamas with clean sheets.